we're kind of starting from a position assuming that you're okay and you're trying to prevent things from happening. But sometimes you may be having symptoms that would indicate that you're having a problem with your heart before we've done that work. I guess I would ask people to pay attention to their own experience as they go through life. If your heart isn't working properly, usually the experience is that it's not pumping very well for what you need. If it's not pumping well enough, it means it's not circulating blood through the lungs, not circulating oxygenated blood out into the rest of the body. So typically, as you need more, as you're exercising, you'll start to get complaints. So you'll start to feel short of breath, or you'll start to find that you just can't go as far as you used to before you peter out. If it's not pumping well enough, you may accumulate fluid in your limbs. You may get edema. You may start feeling short of breath when you lay down, feel better when you sit up. You may get chest pain. The way I was taught about it is, crushing pain in the middle of the chest. But a lot of folks don't feel that. But you might feel some sense of pain or pressure in your chest when you're doing something active, at the peak of exercise or right after that. Women often don't feel it quite as abruptly as men do. Women tend to laminate their arteries, where men tend to put a glob of plaque at a branch point. So men tend to have a little more dramatic experience with plugged up arteries. But in both cases, you'll often feel what you're going to feel as some negative thing that happens when you exercise or when you're more active. And I would pay attention to that. And I'd tell your doctor about that, because sometimes we might miss it. We might not see the risk as quickly as it's happening. For some people, it feels like a GI problem, right? It's all happening right here in your chest. So some people will say, yeah, I get indigestion. When do you get indigestion? When I take a walk. It's like, well, that doesn't make sense, and so we have to think about that. My favorite version of that was a guy that was a runner. He was in his 70s, and he would run for 5 miles a day. And he came in and he said, I'm doing great, but around mile 3, my right elbow starts to ache. I said, you're kidding, right? Your right elbow, right? It's always the left arm. My right elbow aches, and I slow down and it feels better. And then I start running in my right elbow. And sure enough, he had multivessel coronary disease, had to have stents put in. So we really need to pay attention to those stories. And you're the patient, right? So you're the one who's going to know before we know if something isn't quite right. And I would always make sure you tell us, because we may not see it as quickly as you do.